The province is defending its program to send cancer patients to Bellingham in the face of criticism that not enough is being done to ease the backlog for treatment.
From the people I speak to, many are interested in anything that will get them into care faster, get them into treatment faster, and give them an opportunity at life.
BC cancer data provided to CBC News shows a total of 801 patients completed radiation therapy in Bellingham in the year since the program started, June 2023. It's a more complete picture than the figures released by the Health Ministry on Thursday, which gave the figures as of March. However, the number of British Columbians who have been treated in Bellingham is so far just a third of what was promised. When the program was announced last May, Health Minister Adrian Dix said up to 2,400 patients a year would benefit from the program. The goal was to ease the backlog for treatment here in BC, which has some of the longest waits in the country for radiation. Dr. Claudine Stornis-Bliss, a doctor at Surrey Memorial Hospital and BC United candidate for Surrey Cloverdale, said for cancer patients desperately waiting for treatment, the current situation isn't good enough.
Halfway through a program like this, you should be halfway through catching up. And we should definitely be at 100%. My prediction is that, number one, this isn't going to end.
BC Cancer's Chief Medical Officer, Dr. Kim Chi, insists the program is at full capacity.
The 2,400 number was based on patients getting 1 week of treatment, so 5 days of treatment. But many patients don't just get 5 days of treatment. They actually get 2 weeks or 4 weeks or longer of treatment. So in fact, we are using that capacity to what we had planned.
Stornis-Bliss said, looking beyond the numbers, she hears too many horror stories of patients languishing while they wait for treatment.
It's horrible. It's criminal. We should not be accepting this as the new normal.
Not everyone who was tapped for faster treatment in Bellingham has been able to go. Of the more than 3,000 patients referred for radiation there, 2/3 were not able to attend. That's because they didn't have the correct travel documents, they didn't want to travel to the US, they had an upcoming appointment here in BC, or they were too sick to travel. The majority of patients who received treatment in Bellingham were from Fraser Health, followed by Island Health. BC Cancer says that's because patients in those two areas were waiting the longest for radiation therapy. The province hopes the new Surrey Hospital and Cancer Centre will ease some of that pressure, but critics say that solution is at least 6 years away. Katie DeRosa, CBC News, Victoria.